because I was really disturbed, like many of you might have been, to find out that there is a sick experiment on children about to take place in the United Kingdom. A new clinical trial starting in January, of course. King's College London will recruit up to 220 under 16-year-olds experiencing what they call gender distress. They'll randomly assign half of them to start puberty blockers straight away. The other half will be made to wait a year, all while scientists monitor what happens to their bones, their brains and their mental health. This comes just months after the Cass Review slammed the door on these drugs, warning the evidence base was shockingly weak and many youngsters suffered devastating harm. How much more information do you need? The government banned routine prescriptions indefinitely under the Conservatives, yet now, astonishingly, we're told the only ethical way forward is to experiment on children again. It's absolutely insane. Critics, including Kira Bell, the young woman who detransitioned after blockers and surgery at the Tavistock clinic, call it disgusting. Legal challenges are already being prepared, of course. And let's not forget, when Labour came into power in July 2024, the new Health Secretary, Wes Streeting, immediately defended and extended the Conservative government's emergency ban on private prescriptions of puberty blockers. He then made it indefinite in December 2024, citing that same report that had slammed these drugs, the Cass Review. So why, Mr. Health Secretary Wes Streeting, why the silence now? Why are you allowing the NHS and these clinical studies to go ahead on our children? There should be no circumstances where puberty blockers are ever allowed to exist in this country. And I put that to the rest of the panel. I'll start with you, Dr. Renee, as of course you are a doctor. What do you make of all of this?
I mean, look, this trial has only been granted because, and I'm going to say this, Hilary Cass, who had the best intentions, was harangued by the trans lobby, one in particular, and this particular clause was put in to satisfy them. This trial falls down on the Nuremberg Code on nearly every single area. First and foremost is that you must be able to get informed consent. As a doctor, I would argue that a 10-year-old cannot comprehend never having children. So they cannot give informed consent. The experiment should benefit society. If this group is so small, as Kai is always telling us, there is no wider benefit to society. No disabling injury must occur. Lots of these children, as you've rightly pointed out, end up with disabling injuries and are going to take the NHS to court. I could go on. We already know that most children who are showing issues with the sex that they're born in, if they're left to go through puberty, which is one of the most important parts of an adult forming, up to 93% of them will settle with their own sex and get on with it. Then of the 7 left, many are gay and finding it quite hard to cope with.
It's a form of conversion therapy, in my opinion. Will, what do you make of this?
Well, Helen Joyce has said that on many occasions that this really is an attack on gay, often autistic young children. It's disgusting. It is morally abhorrent. Gender dysphoria, which is a very, very small, or affects a very small group of people, is a mental condition or something that should be treated with psychological therapy and help through psychological means. The way that we somehow think that it needs to be treated by stopping people's puberty, which has irreversible consequences, will go down as one of the great human rights atrocities of our time.
I absolutely agree. Kai, how can anyone defend this sick experiment?
I'll tell you how. The framing of your argument just now, Alex, was one of the worst faith framings I've ever seen on this. You know it's a nonsense, and I'll tell you. I'll tell you why.
All right, go on.
I'll tell you why.
Go on.
You well know that the Cass Review that slammed the door, as you say, on the use of these drugs also said that the evidence base is weak and therefore there should be a clinical trial. That's exactly what's being proposed here for 200 max children. The safeguards, there are safeguards that prevent children from accessing this if they have vulnerable mental health, for their family situation, and if they're unable to give informed consent. I'm glad you said, Will, that this could be an irreversible treatment, because what is more irreversible than that is allowing thousands of children to be completely denied of their existence, and people like you who think that they simply don't exist and simply shouldn't be considered.
That's not what these
as part of it is the effect of what they're saying. Because what you would have is to do nothing, is to do absolutely nothing to support these kids.
Look, Dr. Renee just said, right, you talk about 93% settle, and then about 17% become gay, which is absolutely fine.
Well, no, they don't all become
right?
gay.
But what we're talking about are these irreversible changes, and we're talking about bone density changes, fertility changes.
And that's what the trial will look at.
Psychological changes.
That's what the trial will look at.
We don't experiment on children.
I'm in favour of...
There are no clinical trials on children. Full stop.
We do very few.
So that's what we're hearing. Because you can't just say that on this issue, it's different to any other medical issue that we're looking at.
I'm sorry, I can. OK? There is no other condition where people believe they are something that they are not. Let's talk anorexia, for example, where we intervene and actually reinforce their belief. There is no other condition.
What comes across every single time in these conversations I have is, frankly, none of you know the effect that these kinds of treatments can have, the positive effect that they can have for the mental health and survival of trans kids. It's clear to me that none of you know any trans kids.
I'm going to have a final word on this. It is utterly deplorable and disgusting that anybody, scientist or otherwise, would first of all get involved in these sick experiments, but for anyone to defend it. This is children's lives we are destroying. Our government is actively allowing this to take place rather than intervening. I hope you're watching Wes Streeting, because you should be intervening to stop children from many of whom have criticised these. Many have gone through the transition before, and their lives are ruined. Their lives are ruined.
I would also just like to come back at Kai. The only decent evidence there is on whether or not transition and improves mental health shows that once these kids have transitioned, their mental health is worse and they are more likely to commit suicide. I can send that data to you, Kai.
And I'm sorry, Alex, 10 seconds. I never said we should do nothing, Kai. I said the answer is therapy, it is talking, it is psychological assistance, it is not irreversible medical experiments.
Totally agree. Unfortunately, I thought this issue was going to be put to bed. I thought this health secretary tried to portray himself as a man of at least trying to get away from the craziness of the far left. But yeah, well, that's what it is, isn't it? And unfortunately, we're seeing this happen in America. And unfortunately, again, we're going to have to wait until a sensible government comes in and decides it wants to protect our children. But I think that experiment, this sick thing that's going to happen, is going to ruin those children's lives. 200 or none. Anyway, listen, Department of Health and Social Care spokesperson has said this: young people with gender incongruence need access to high-quality, safe and effective care. We are following the Cass review, which was clear that the evidence on care for these children is lacking, and proposed this research to help provide it. Medical care must always be based on solid evidence, and children's safety must come first, indeed.
Indeed.
Unfortunately,